am Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Hydrosalpinx is a medical condition which is characterized by accumulation of fluid within the fallopian tubes. This could lead to the dilation and enlargement of these tubes. This term hydrosalpinx is derived from the Greek word hydro meaning water, salpinx meaning tube. It is typically diagnosed during evaluation for fertility, and it can significantly impair fertility by obstructing the passage of eggs from the ovaries to the tubes, and therefore if fertilization happens and an embryo is created, the embryo is also obstructed from traveling into the uterus. Let's try to understand the symptoms, causes and treatment. We'll begin with symptoms first. There could be pelvic discomfort or pain. Hydrosalpinx may cause discomfort, pain which can range from mild to severe and may be chronic or intermittent. There could be abnormal vaginal discharge. Women with hydrosalpinx may experience this discharge which can be clear, watery or slightly colored. This discharge is typically due to the accumulation of fluid in the fallopian tubes. Infertility. One of the most common symptoms of hydrosalpinx is infertility. The presence of these fluid-filled tubes can obstruct the passage of eggs from the ovaries into the tubes, and if there is fertilization, then this embryo may be hindered to travel into the uterus. Women with hydrosalpinx may struggle to conceive naturally and may require fertility treatment. There could be pain during intercourse also. Some women with this problem with hydrosalpinx may experience pain during intercourse, which is called as dyspareunia. Especially in severe cases, hydrosalpinx can lead to abdominal swelling or distension if these fallopian tubes become significantly enlarged due to fluid accumulation. Let's look at the causes. To begin with, we should talk about pelvic inflammatory disease, and it's the most common cause of hydrosalpinx, which is often caused by sexually transmitted infections such as chlamydia or gonorrhea. These infections can lead to inflammation and scarring of the tubes, resulting in accumulation of fluid. Endometriosis is also one of the reasons. It is a condition where tissue similar to the lining of the uterus grows outside the uterus, which can lead to development of hydrosalpinx. Endometrial tissue can block the fallopian tubes or disrupt their normal function, leading to fluid accumulation. A previous tubal surgery, such as tubal ligation, which is a surgical sterilization, or tubal anastomosis, which is a tubal reversal surgery, can sometimes result in formation of hydrosalpinx. Surgical procedures may cause scarring or adhesions within the fallopian tubes, obstructing the flow of fluid. Some other causes which are less common may also occur, such as pelvic adhesions, uterine fibroids or congenital abnormalities of the reproductive tract. So how do we diagnose? A physical pelvic examination may reveal tenderness or swelling in the pelvic area, which can be suggestive of hydrosalpinx. There are some transvaginal ultrasound examinations also, which are often used to visualize the pelvic organs and detect the presence of fluid-filled structures which are indicative of hydrosalpinx. Other imaging tests such as hysterosalpingography or saline infusion sonohysterography may also be performed to evaluate the fallopian tubes. Laparoscopy also can be performed in some cases, which is a minimally invasive surgery procedure to directly visualize the fallopian tubes and confirm the diagnosis of hydrosalpinx. During laparoscopy, a thin flexible tube with a camera, which is called as a laparoscope, is inserted through a small incision in the abdomen to examine the pelvic organs. Let's look at the treatment options. In cases where hydrosalpinx is asymptomatic or mild, medical management may be recommended to reduce the symptoms and prevent complications. This may include pain management with medications which are prescribed by your gynecologist. If hydrosalpinx is caused by pelvic inflammatory diseases or an infection, antibiotic therapy may also be prescribed to treat the infection and reduce inflammation. In cases where hydrosalpinx is severe or causing significant symptoms, surgical intervention may also be necessary, and these options include salpingectomy, which involves the removal of affected fallopian tubes that can improve fertility outcome. In some cases, surgical procedures may be performed to remove blockages or repair damaged portions of the fallopian tubes that can preserve fertility. For women struggling with infertility due to hydrosalpinx, ART or assisted reproductive technologies such as IVF may be recommended. During this process, eggs are retrieved from the ovaries and fertilized with the partner's sperms in the laboratory setting, which means that the tubes are not at all required for creation of these embryos that can be transferred back into the uterus. What are the fertility outcomes? What is the prognosis in such patients? The prognosis for women with hydrosalpinx depends on the severity of the condition and whether fertility treatments is pursued or not. When surgical intervention of ART may improve fertility outcomes, the presence of hydrosalpinx can still be challenging to overcome, especially in terms of conception. Without proper management, hydrosalpinx can lead to complications such as chronic pelvic pain, recurrent infections, and further damage to the fallopian tubes or surrounding pelvic areas also. Diagnosis typically involves imaging studies. Early diagnosis, therefore, and appropriate management are essential for optimizing fertility outcomes in women with hydrosalpinx. If you wish to understand more, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.